I am going to show you 5 ways how you can prevent burnout, overwhelm, and live your best life, healthier lifestyle so you can care for your patients more effectively. Let's jump into it. Hey, welcome back to my channel. If you're new to me here, my name is Ashika Turner, and on this channel, we strive to create a happier, healthier, wealthier lifestyle, right? So if that sounds like a community that you would like to be a part of, please go ahead and hit the subscription button. While you're at it, hit the notification bell so you won't miss my next videos to come. In today's video, we're going to talk about a crucial topic that nurses face. Yes, we are in Nurses Week, and in spite of that, being a nurse myself, this video is for my nurse tribe. Where are my nurses? Put a finger up. Are you a nurse? Put a finger up. Are you feeling stressed, burnt out, and overwhelmed in your career? Stick a finger up. So we're going to address that today. Yes, we know nursing is a very rewarding career, but with nursing at times, there comes stress, there comes burnout, there comes overwork, there comes overwhelm, and there comes poor work-life balance. And we're going to talk about that. Let's get into it. I am going to show you 5 ways how you can prevent burnout, overwhelm, and live your best life, healthier lifestyle so you can care for your patients more effectively. Let's jump into it. Number 1 is taking your breaks. One of the most important things that you can do to decrease your stressors is to take your breaks, your lunch breaks, your coffee breaks, whatever break that is, you need to take your break. Yes, I know oftentimes due to the shortage of staff in the facility, leading to nurses have to cover this one, that one, and it's challenging to take your breaks because of the high caseload that you have, the high client load, but it is still important for you to take your breaks. Even 5 minutes. Nurses hold up their urine. Nurses get urine infection. We need to stop this. We need to stop this. As nurses, we should know better and we should do better. Go ahead and take your coffee break. Go and take your washroom break and take your lunch break, right? And for a lunch break too, if you can even go for a walk while on your lunch break, that's even better. You're getting fresh air outside. So rather than to sit in the lunchroom, talking to other colleagues, you need a mental break. So just take a walk, take a stroll, maybe go somewhere quiet and have your break. Number 2, engaging in self-care. Are you caring for yourself as much as you care for your clients? We're guilty. We need to take care of ourselves. Do whatever makes us happy. So rather than picking up the overtime shift, yes, I know you need the finances, and I think I'll be doing a video around that. Let me know in the comments if you need a video talking about side hustles nurses can start doing. I think that might be my next video. Sounds like a good idea, is it? Let me know. Anyways, it is important to do the things that fills your cup. What are some of the things that brings you joy and happiness? Is it reading? Is it having family time? Is it creating YouTube content like I do? What is it? You need to find those things that makes you happy. Find some time for self-care. Relax, unwind, put your feet up, have a Netflix night and chill. Whatever it is, bubble bath, a spa day, go get your nails, your hair done. Whatever fills your cup, you need to find time to do that self-care. Number 3 is setting boundaries. And this, again, is another very important point, which will prevent burnout, overwork, and high levels of stress. You need to set boundaries with your work life and your family life, with colleagues, with clients. You need to just set boundaries overall. You know that you're tired. They call you to do the overtime shift. Yes, I just spoke about that in self-care, but that's also having some boundary. You already plan out your family day. They call you for a shift, you pick up the shift. Gone away from your family, cutting back from that family time. Where is the line between the work and your personal life, right? Other nurses, depending on the facilities that you work in, there's oftentimes the temptation to take home work, extra work, like case management, whatever areas, where you're not at the bedside, you take home that extra work, and then that extra work now drizzle over into your family life, your personal time, your time to do other stuff. No, leave the work at work, right? If you're working from home also, you need to know what time is it to shut off, log off from the computer, and flip the switch. I always tend to like to call it flipping the switch to off work, and on family time, me time, home time, right? One of the things I usually do when I was working inpatient, and mental health, as I mentioned before, I'm a mental health nurse, and mental health can be mentally draining. You hear clients with schizophrenia, they're having hallucinations, they're having delusions, and it gets to you oftentimes. So what I usually do to flip that switch is usually my time driving, commuting to home, from work to home. I will put my windows down, I will play some music, and I will just try to get into another space. During that time, I will try to avoid any phone calls. It's just me time, getting myself reset to enter my home in a more open and welcoming environment. Because if you take that stress from work to home, that is added stress and added, it just more on you mentally. So you find how you can create that balance and that boundary, crossing that line between work life and home life, right? So that's boundaries. Number 4, connecting with colleagues, venting, having a buddy at work that you can run to when something goes wrong. Yes, this one is very important. At times, a patient stress you out so much. It's so much. Your workload is so much. Family member is calling, and you have to be respectful and you have to compose yourself very well. But you need somebody to release the tension to. And you need to just vent. Do you have a colleague at work where you can pull aside and say, do you have a minute? Can I talk to you for a minute? No, this is very, very important. And I find it is a way of releasing. Just, when you have a balloon and it just go until it pop by itself. So oftentimes to prevent that you from going to just pop, you just, you're blowing the balloon and you just let out the air. So you deflate yourself by venting to a colleague. This is so effective. I do that at work. I have my colleagues and I'll just go, knock on the door, enter. Do you have a minute? And once they hear that, they know it's venting time. And I remain open also to give a listening ear to my colleagues when they need to vent. So that's number 4, connecting with colleagues to release some tension, venting. Number 5, seek help. Do you seek help when you're overwhelmed? You come to work, and when you look at your caseload, it's so demanding. Your workload is so demanding. You have so many things to do. Client to accompany to appointment, phone calls, group meetings, family meetings, discharge planning, medication, and you find you're getting so overwhelmed at times. And at times, some of these assignments, you can ask for help from a colleague. You can go to your manager, to say, hey, my workload is too much for me today. Can you reassign this client? Or can we do an exchange? Or can you have somebody to back me up? Are you asking for that help? It's time. This will help to release your stressors, release your burnout. And again, if you're not feeling mentally well, workplace, they have wellness, different wellness programs to help with mental health. My workplace have that. I'm not sure about yours. There should be different options and different programs for employers, such as healthcare workers, to seek help. For us, for our organization, we have massage chairs. You can go, relax, unwind. You have help assistance for mental health, for therapy. You have massage. People come in and they give you a 15-minute massage. And you have several different programs that you can participate in for your own mental wellness. Again, if you are not feeling well, if it's getting to a point where it is extremely stressful, then you need to speak to a professional. Get help. Get help. Your mental health comes first. And we have to remember that as nurses. If something happened to us today, we are replaceable. They're going to replace us. If you're off on a 4 week, 5 week sick leave, they're going to have coverage. They're going to have somebody to cover you. If you drop down and dead tomorrow morning due to high levels of stress, they are going to find somebody to cover you. So you need to make it a priority to protect yourself, look out for yourself, and know strategies to control the high levels of stressors and to prevent burnout. Thank you so much and stay tuned for my next video. See you then.